everyone, welcome to Try Right. This is Pack 65 and myself Srija. So today in this session you're going to learn about anesthesia. What are the common errors to avoiding anesthesia? And also you're going to learn about the code ranges within anesthesia coding. So what are the common errors to avoid? So first is underreporting time. So what does it mean? So not recording the full anesthesia time correctly. So why it matters? Because anesthesia payment depends heavily on the time units. So you have to always record the exact start time. So when anesthesia begins, and always record exact end time when anesthesia care ends. So even a few minutes missed, it results in the less reimbursement. So for example, if anesthesia started at 9:05 a.m. and ended at 10:25 a.m., so write exact times, not rounded values. So what is the incorrect modifier usage? So what does it mean? So using the wrong anesthesia modifier. So modifiers tell who provided the anesthesia and how they had provided. So what are the common anesthesia modifiers? AA, anesthesia by anesthesiologist. QK, medical direction of 2 to 4 CRNAs. QX, CRNA with the medical direction. QY, anesthesiologist medically directing 1 CRNA. QZ, CRNA without medical direction. So using of wrong modifier gives claim denial or reduced payment. So third is not using qualifying circumstances. So what does it mean? Forgetting to report special patient conditions. So why it matters? Because qualifying circumstances always add extra anesthesia units, increasing the payment. So what are the common qualifying circumstances? Include extreme age, either very young or very old patients, emergency surgery, severe trauma, and also complicated medical conditions. So if the case is high risk, you have to always check for qualifying circumstance codes. So how to find an anesthesia code in the CPT code book? So step 1 is you have to go to anesthesia section. So anesthesia codes are located at the beginning of the CPT code book. So the code range is 00100 to 01999. So anesthesia is always a separate section which is not mixed with the surgery sections. And step 2 is identify the body area or procedure. Anesthesia codes are grouped by body system, surgical site as well as type of the procedure. For example, 00100 series are for head, neck and brain procedures, whereas 00800 series are for lower abdominal procedures. So you don't code anesthesia based on the surgeon's CPT code directly. You have to code based upon where the surgery is performed. So anesthesia coding uses the base units, time units as well as modifier units and qualifying circumstance units. So anesthesia time is counted in minutes. Then it is converted to units. So anesthesia codes do not use the global periods like the surgery codes. So documentation must clearly show the start time, the end time, the provided type and medical direction status. And the third step is you have to use the alphabetical index. So what does it mean? So CPT book has an alphabetic index list at the back. So why it helps? Because it saves time and helps you to find the possible codes quickly. So how to use it? You have to look up the keywords like anesthesia, body part like shoulder, knee, abdomen, and also the procedure name. So for example, you have to search anesthesia shoulder. So you will see a list of suggested code numbers. So never code directly from the index, it only guides you. The fourth step is cross-reference with descriptions. So what does it mean? After finding a code in the index, verify it in the main CPT section. So why it matters? Because the index may show multiple possible codes and only one will match the actual surgery. What to check? The body area, the type of surgery, whether it's open, laparoscopic or diagnostic, or any exclusions or notes. So you have to always read parenthetical notes and guidelines under the code. And the fifth step is check modifiers if needed. So what does it mean? Some anesthesia cases, it need extra modifiers for accuracy. So what are the common anesthesia modifiers? Physical status modifiers P1 to P6. So P1 is healthy patient, P2 is mild systemic disease, P3 patient having severe systemic disease, P4 severe disease with constant threat to life, and whereas P5 is moribund patient and P6 is for brain dead patient, serves as an organ donor. So all these common anesthesia modifiers we have seen in the last session. And also qualifying circumstances which are used for emergency surgery, extreme age and complex or high risk conditions. So sixth step is you have to use CPT assistant or anesthesia guidelines if needed. So what does it mean? When you are unsure, you have to use official CPT guidance. So why it matters? Because some anesthesia cases are confusing or uncommon. So CPT assistant gives real world explanations as well as examples. And what these resources clarify: which anesthesia code to choose, when modifiers apply, how to report unusual or combined procedures. So CPT assistant is often used in audits and exams as a reference. So the alphabetical index is a starting point but not the final answer. So you have to always confirm the codes in the numeric section. So modifiers tell the complete clinical story, and anesthesia coding depends upon the procedure location, the provider type, a patient condition, and also the time documented. So here is a question: anesthesia for vasectomy. So we want to find the correct anesthesia CPT code for a vasectomy. So remember, surgery code and anesthesia code are both different. So we are coding anesthesia service but not the vasectomy itself. So first step is go to anesthesia section. So in the CPT book, anesthesia codes are at the very beginning. So the code range is from 00100 to 01999. So if the service is anesthesia, always start in this section. Step 2 is you have to identify the body area. So look up genitalia or lower abdomen anesthesia codes. So vasectomy is a procedure on the male genital organs, right? So anesthesia codes for male genitalia, and in male genitalia you have to look up for lower abdomen, usually fall under 00920 to 00936 code ranges. So anesthesia codes are always grouped by body part but not by disease. So step 3 is to check the alphabetical index. So you have to go back of the CPT book. So look under anesthesia, then vasectomy or male genitalia. So this directs you to the correct numeric code range. So never code directly from the index. So it only guides you. And step 4 is verify the code. So after checking the numeric section, CPT 00921 code, it is commonly used for anesthesia for vasectomy. So why this verification is important? Because it confirms the correct body area, it confirms the procedure type, and it prevents the claim rejection. Anesthesia code versus surgery code. So vasectomy surgery code is not equal to anesthesia code. Anesthesia code describes anesthesia service only. So for a typical vasectomy, the commonly used anesthesia code is CPT code 00921. The description for 00921 is anesthesia for procedures on male genitalia including vasectomy. So you have to always read and confirm the description to ensure it matches the procedure being done. So why confirmation is important? Because many anesthesia codes look similar. So choosing the wrong body area code, it can always cause the claim denial. So always verify in the numeric CPT section, not just the index. Now understanding the anesthesia code grouping. So anesthesia CPT codes are organized by body region, not by disease or diagnosis. So major anesthesia code categories are shown on this slide. Head is classified under 00100 to 00322 code, where it includes brain, skull and facial surgeries. Whereas neck region is for 00300 to 00352 code ranges. Neck is for thyroid, neck vessels and lymph nodes. Next is thorax region, which is a chest wall and shoulder girdle. and it includes codes around 00400 to 00474. And under thorax, you can see the procedures, anesthesia for the procedures on rib, chest wall, shoulder area and procedures. Intrathoracic 00500 to 00580. Heart and lung surgeries. Next is spine and spinal cord. The code ranges are from 00600 to 00670. This includes back and spinal surgeries. And upper abdomen 00700 to 00797. It includes stomach, liver and gallbladder, which are situated in the upper abdomen. And coming to lower abdomen, appendix, intestines and hernia repairs are located in the lower abdomen. So the code ranges are from 00800 to 00882. Perineum is for 00902 to 00952. So perineum, it includes male genitalia, rectum, anus and vasectomy also falls here. And next is pelvis except hip. So exception is for hip and pelvic organs excluding the hip joint. So the codes are from 01112 to 01173 codes. And next is upper leg except knee. So used for the procedures on thigh and femur. The code ranges are from 01200 to 01274. Knee and popliteal area. So this is used for knee surgeries as well as the procedures which are performed behind the knee. That is popliteal area. So the code ranges are from 01320 to 01444. And next is lower leg, below knee, which includes ankle and foot. So these are used for tibular or fibula surgeries, ankle surgeries and also foot surgeries. So the code ranges are from 01462 to 01522. Next is shoulder and axilla. The code ranges are from 01610 to 01680. So these are used for shoulder joint surgeries as well as armpit procedures. Upper arm and elbow 01710 to 01782. These are used for humerus and elbow surgeries. So forearm, wrist and hand, which is used for radius ulna and wrist, and also finger and hand surgeries, which falls under category 01810 to 01860. Radiological procedures 01916 to 01942. So this is used when anesthesia is provided for MRI, CT scan and other imaging procedures. Burn excisions or debridement. So this is used for surgical removal of the burn tissue and as well as the cleaning of the severe burns. So the code ranges are from 01951 to 01953. Obstetric anesthesia. So these are used for labor and delivery as well as C-section anesthesia. Code ranges are from 01958 to 01969. And other procedures, so which are used for miscellaneous or uncommon anesthesia services, are listed under categories 01990 to 01999. So next is coming to, so let's discuss about all these code ranges briefly. So head anesthesia codes are from 00100 to 00322. So this section covers head and facial procedures. So CPT code 00100. So this is the anesthesia for procedures on salivary glands, including biopsy. Whereas 00102, anesthesia for procedures involving plastic repair of cleft lip. So it includes the plastic repair of the cleft lip. Next code is 00103. So this is used for blepharoplasty and ptosis repair. Blepharoplasty is nothing but eyelid surgery and ptosis surgery is the drooping eyelid. So anesthesia given for reconstructive eyelid procedures are 00103 code and 00104 electroconvulsive therapy. So anesthesia provided during the ECT for psychiatric treatment. So even though this is not a surgery, anesthesia is still required. So it has a CPT anesthesia code. And next are ear-related anesthesia codes. 00120 ear procedures. So generally used for external ear, middle ear, inner ear as well as ear biopsy when no specific ear code is fitted. And next is 00124 for autopsy, otoscopy. So otoscopy, this is used for examination of the ear canal and eardrum under anesthesia. 00126 tympanotomy. So the full description of 00126 is anesthesia for procedures on external, middle and inner ear including biopsy as well as tympanotomy. Because 00120 is the intended code and 00126 is a child code. So 00140 eye procedures which are general. So this 00140, it is used when the eye procedure is not specifically listed elsewhere. Next is 00142 lens surgery. So this is generally used for cataract surgery and lens replacement. 00144 code is used for corneal transplant. So replacing damaged cornea. 00145 vitreoretinal surgery. So this is used for retinal surgeries and vitreous body procedures. 00210 and 00211, 212, 214. So these are anesthesia for brain and intracranial codes. So 00210 is for general code. So this is used when the brain procedure is not otherwise specified. Whereas 00211 for craniotomy or craniectomy. So this is used for opening skull to remove the hematoma or the blood clot. And subdural taps means removing the fluid or blood from the subdural space. So you have to assign 00212 for subdural taps. And 00214 burr holes including ventriculography. So these are the small holes drilled into the skull. So whenever anesthesia is given for drilling small holes into the skull, you have to assign the code 00214. And next 00215. Cranioplasty or elevation of the depressed skull fracture and as well as extradural, that is outside the brain covering. So it can be simple or compound. So anesthesia given when surgeons repair the skull or lift a sunken skull fracture. So this is about the head code ranges. So coming to neck ranges 00300 to 00352. So in this, under the neck we have different procedures. Different anesthesia codes for different procedures. So these codes, they are used when anesthesia is given for procedures on the neck structures such as skin and muscles, thyroid, larynx and trachea and blood vessels of the neck. So 00300 is for anesthesia for the procedures on the skin, muscles and nerves of the head, neck as well as the posterior trunk. So when no specific code fits, you have to use NOS codes, not otherwise specified. So next code is 00320. So anesthesia for procedures on esophagus, thyroid, larynx and trachea. So lymphatic system of neck for patients aged 1 year or older. 00322 needle biopsy of thyroid. So anesthesia given during thyroid needle biopsy. So for procedures on the cervical spine or spinal cord, you should not use codes like 00600, 00604 and 00670 because these are the neck codes. You should not use this for cervical spine or spinal cord. And 00326 is for procedures on the larynx and trachea in the children younger than 1 year of the age. And 0035 for major ulcers of neck. And 00352 is for ligation, simple ligation. And next code categories are for thorax, chest wall and shoulder girdle. The code ranges are 00400 to 00474. So what does this thorax mean? Thorax is a chest area including chest wall, breast, clavicle which is the collarbone, scapula which is the shoulder blade, ribs and shoulder girdle. So these codes are used only for anesthesia services but not for the surgery. And 00400 is anesthesia for procedures on skin, extremities, anterior trunk and perineum when no specific anesthesia code fits. So this is a general or NOS code. 00402 for breast reconstructive procedures such as breast reduction, breast augmentation and muscle flap reconstruction. 00404 anesthesia for radical or modified radical procedures on breast. 00406 anesthesia for radical breast surgery, and this is more extensive than 00404, so it has a separate code. And 410 for electrical conversion of arrhythmias, that is cardioversion, used when electricity is given to correct the abnormal heart rhythm. 00450 anesthesia for procedures on the collarbone and the shoulder blade. 454 biopsy of the clavicle. 470 anesthesia for partial rib resection. 472 it is for thoracoplasty any type. So thoracoplasty is nothing but reshaping or removing the ribs to treat the lung or chest conditions. And 00474 the anesthesia for radical chest wall procedures. For example, pectus excavatum. This is a sunken chest correction. So next code category is intrathoracic region, anesthesia for intrathoracic. The code ranges are for 00500 to 00580. So anesthesia for all the procedures on esophagus is assigned 00500 code. So this is used when surgery or procedures involve the esophagus, the food pipe. So examples like esophageal dilation, esophageal tumor surgery, and repair of the esophageal injury. So no matter what type of esophageal procedure it is, anesthesia is reported using 00500. And 00520 is the anesthesia for closed chest procedures. For example, diagnostic bronchoscopy and minor chest procedures without opening the chest. And 00522 is for needle biopsy of the pleura. Pleura is a thin lining around the lungs, and needle biopsy is a sample taken with the help of the needle. So anesthesia is given for needle biopsy of the pleura. 00524 anesthesia for pneumocentesis. So pneumocentesis is nothing but it's a removing of the air or fluid from the chest cavity. So this is often done for collapsed lung and pleural effusion. So any anesthesia for removing the air or fluid from the chest, you have to assign the code 00524. And 528, this for mediastinoscopy and diagnostic thoracoscopy. So mediastinoscopy is the exam of the area between the lungs, and thoracoscopy, it's a camera used to look inside the chest. So both the lungs are ventilated. So if both the lungs are working during the procedure, you have to use 00528 and 00529. So one lung is intentionally collapsed here. The other lung does only breathing. So in these cases, you have to assign 00529. And code 00560 is for anesthesia for procedures on heart, pericardium or great vessels without pump oxygenator. So there is no heart or lung machine used. For example, pericardial window and minor cardiac procedures. 00561. So with pump oxygenator younger than 1 year. So with pump oxygenator means a heart-lung bypass machine is used. And this is often used in the infants. So do not report 00561 with 99100 in the extreme age condition, 99116 in the hypothermia condition, as well as 99135 in the emergency condition of the qualifying circumstances. And the code 00562 with pump oxygenator age 1 year or older. So this code, it is used for valve surgeries, non-coronary bypass procedures and reoperations done more than 1 month after the original bypass. So if it is less than 1 year, you have to assign 00561. If it is greater than or equal to 1 year, you have to assign 00562. Our next code ranges are for spine and spinal cord. So the CPT codes are used by anesthesiologists when anesthesia is given for spine or spinal cord procedures. So the codes are grouped by the region of the spine and by the special situations that make the anesthesia more complex. So what are the spine regions? Cervical in the neck, thoracic in the upper and mid back, chest level, and lumbar at the lower back. So CPT code 00600. Anesthesia for procedures on the cervical spine and spinal cord not otherwise specified. So this is used for most of the cervical spine surgeries. For example, cervical disc surgery, cervical laminectomy, cervical spine cord decompression. So if it is a cervical spine surgery and there is no special condition mentioned, you have to assign the code 00600. 00604. Procedures with patient in the sitting position. So patient is sitting upright, not lying down. So sitting position increases the risk of air embolism as well as the blood pressure changes. 00620. Anesthesia for procedures on thoracic spine and cord. So this is used for the thoracic, that is mid back of the spine surgeries. For example, thoracic disc surgery, thoracic spinal cord tumor removal. A simple rule is, if it is a thoracic spine surgery routine approach, you have to assign the code 00620. CPT code 00625. Utilizing one lung ventilation. So thoracic spine surgery via anterior thoracic transthoracic approach without one lung ventilation. So surgeon enters through the chest as the front approach and both lungs are still ventilated. And 6264 with one lung ventilation. One lung is intentionally collapsed and used to improve the surgical exposure. And 00630 CPT code. So anesthesia for procedures in lumbar region not otherwise specified. So this is used for most lower back lumbar surgeries. Examples like lumbar disc surgery, lumbar laminectomy, and spinal stenosis surgery. So lumbar spinectomy, you have to assign the code 00630. And CPT code 00632. Lumbar sympathectomy. So this is a surgical destruction of lumbar sympathetic nerves. So these are done to treat severe peripheral vascular disease, chronic pain, and hyperhidrosis, that is excess sweating. So the specialized procedure is to separate code 00632. And next code is CPT 00635. Diagnostic or therapeutic lumbar puncture. So lumbar puncture is the spinal tap which is done for CSF testing, nothing but cerebrospinal fluid testing, meningitis and MS. So this is also for spinal anesthesia and intrathecal medications. So even though it seems minor, anesthesia services are coded separately and assigned 00635 code. So this is for today's session. I hope the session has helped you. In the next session, you will be able to learn anesthesia codes for upper abdomen, lower abdomen and many more regions like perineum and pelvis code ranges. Thank you.